Good morning. Good morning. Wow, what a great welcome. Thank you for coming out today. We're going to get some much needed rain, but we've got a great turnout today. My name is Tony Shuman. I'm the president and CEO of the YMCA Metropolitan Fort Worth. On behalf of myself and my YMCA colleagues from Arlington and Dallas, I'd like to welcome you to the YMCA Diabetes Prevention Program Community Forum. This is an important forum bringing awareness to the YMCA Diabetes Prevention Program. The Diabetes Prevention Program is an innovative lifestyle modification program that helps adults with prediabetes reduce their risk of developing type 2 diabetes. The YMCA's Diabetes Prevention Program teaches participants how to make positive behavior changes, including healthier eating and increased physical activity, which will help reduce their risk of getting this disease. Most importantly, the Y's Diabetes Prevention Program is now available for qualified seniors at no cost. This is thanks to a $12 million Healthcare Innovation Award from the Center for Medicare and Medicaid Innovation. North Texas was one of 17 communities across the country that was selected to take part in this project in an effort to show that a community-based organization can reduce new cases of type 2 diabetes in seniors and reduce the cost burden of the disease to our nation's healthcare system. On our panel today, in addition to my Y colleagues, we have Quinn Neal from the American Diabetes Association and Congressman Marc Veasey. Congressman Veasey represents the 33rd Congressional District, which spans from Fort Worth to Dallas and includes prominent neighborhoods in both Tarrant and Dallas County. Congressman Veasey serves on many committees and caucuses, including the Congressional Diabetes Caucus. Congressman Veasey has been very involved and a great supporter of our YMCA in Fort Worth, serving on a branch board, and I know that his family has participated with the YMCA in Arlington. I'd like to ask Congressman Veasey to share a few remarks with us now. Mark?
And Tony, thank you very much, and it's good to be with you this morning. I just want to thank everybody that has been a part of fighting diabetes here in the Metroplex, the American Diabetes Association, YMCA Metropolitan Metropolitan YMCA of Fort Worth, YMCA of Arlington, YMCA of Dallas, and all of the organizations that are partnering to bring the Diabetes Prevention Program here to the Metroplex. This program is important, and one of the reasons why it's important because it will identify seniors on Medicare who are pre-diabetic. I think that's important to stress pre-diabetic, give them the intensive education and support they need to make the lifestyle changes that they need to not develop diabetes. I think that is so key. This program has begun and is successful. I'm going to be excited to hear about what Mr. Garcia is going to mention a little bit later, and also Tony mentioned to you that I'm on the Congressional Diabetes Caucus, something that is very important to me, just because I know that if we continue to raise awareness about diabetes, that we can do a lot just to change what's going on here, not just in the Dallas-Fort Worth Metroplex, but really around the country as it relates to diabetes. Just a little bit more about the caucus that I'm on. This caucus was particularly formed to educate members of Congress on diabetes, and particularly our legislative staffs that work very hard to put together the legislation that we need to move the country forward on preventing and fighting diseases like diabetes. We work very hard to raise awareness about certain research, education, treatments that are out there to prevent diabetes. And it's something that I can tell you that it's bipartisan. It's something that both parties care deeply about. Also, we're going to be working very hard to enact legislation to provide Medicare coverage for blood testing strips, like glucose monitors, diabetes and self-management education, many of those things that are already available, and continuing to urge Centers for Medicare and Medicaid Services to provide coverage for the insulin infusion pumps, something also we're going to continue to work on. Diabetes, particularly type 2 diabetes, is a major problem in Texas, and particularly for the district that I represent. Approximately 1.8 million adults in Texas were living with diabetes. 9.2 of the constituents that I represent in Dallas and Tarrant County suffer from diabetes, and that's according to CDC data. And as we know, diabetes is a very terrible disease when it's not managed properly. Loss of sight, loss of limbs, extremities, blood pressure issues, heart disease, and stroke. They can really greatly diminish the quality of someone's life if not taken care of. I can tell you that I was very moved last year when I took a tour of the DaVita Kidney Center over in Oak Cliff, just in the Wynwood Shopping Center. And when I walked in there, the lady was giving me a tour and just telling me, I talked about earlier about the diminishing loss of the quality of a person's life, and she was telling me that the people that come in for dialysis, that they have to spend about 3 to 4 hours a day sitting in the dialysis chair, and they have to do that 2 to 3 times a week on average, depending on the individual patient. And you just think about someone's life having to be spent, so much just sitting in that dialysis chair like that. And I asked her, I said, why are you starting to see the increases in diabetes? Is it because of people have inherited a medical issue here? She said, no, it's usually because of lifestyle. And I thought what was more moving was that she said that, and if you go to any of our clinics, you'll notice that about 60% of the patients are going to be black, and about 30+% are going to be Hispanic. And when I was there that day, that's exactly about what it was. And it's really, really sad. And so I just want to applaud everybody that's working to really do something about stamping out diabetes. And I don't think it's any coincidence that the constituents in the district that I serve are having an issue with diabetes, because oftentimes diabetes does hit low-income areas harder than other areas. These are people that are more likely to suffer from chronic conditions such as heart disease. The disease are symptoms of lifestyles that we've talked about, that the doctor talked about when I was at the dialysis center. Too much unhealthy food, too little physical activity. And so we need to continue to work together with organizations like the YMCA that are targeting individuals at risk to give them the education and support they need to get healthy. These are the types of programs I want to work on and continue to support in Congress. And we don't, and throwing money at the issue is not, going to solve everything. We need to try to prevent diabetes from happening in the first place, and that's what's really going to be key. I'm excited about the Affordable Care Act's emphasis on preventive care and how it's going to bring down our health care costs, and we need to be doing the same thing with the diabetes types of programs. Not enough to tell people to eat healthy and exercise once a year at the doctor. We need to have an ongoing dialogue with individuals to ask them to continue to lose weight, get healthy, and fight diabetes. And we can do that with the proper support and the education. We just need to continue to support programs like we have here today. And so I'm proud to be here because I know that not only is this going to help individuals here in West Dallas and in the overall community in the Dallas-Fort Worth Metroplex, but in the long run, if we can work on prevention, if we can do things to keep people out of the dialysis chair, if we can do things to keep people from having to get on prescription drugs in the first place, we can save the federal government a lot of money on Medicare and Medicaid programs. And so, Tony, I want to thank you and everyone here at the YMCA and everyone that's here today, many of our healthcare partners, Los Barrios is here, that are out here working in the community to really make a difference on this terrible disease that we can prevent in diabetes. Thank you.
Thank you, Mark. Your passion around this program and this this debilitating disease is evident, and we really appreciate your support, not only of the YMCA and our program, but just for diabetes prevention in general. I'd now like to introduce Quinn Neal, Executive Director of the American Diabetes Association of North Texas. Quinn will now share with us the impact of diabetes in our community. Quinn?
Thank you, Tony. Thank you so much. And thank all of you for being here and taking the time to learn more about the diabetes problem in our community and what the ADA and the YMCA is doing to battle this disease. I want to particularly thank Congressman Veasey for being here and also for being such a strong supporter of efforts to create a more healthy North Texas. So thank you, Congressman. The vision of the American Diabetes Association really sums up what we're trying to accomplish. We want a life free of diabetes and all its burdens. Let me read you some statistics. 26 million people, that's the estimated number of children and adults in the country that have diabetes, and 7 million don't realize they have it. 80 million, that's the estimated number of Americans who have prediabetes or dangerously elevated glucose levels. And the vast majority of those people will develop diabetes if their lifestyle doesn't change. 780,000, that's the number of people in the North Texas area that have diabetes. And that's about 10% of our population. Nationally, the statistic is 7%, so we're above the national average, unfortunately. And about 325,000 people don't realize they have it in North Texas. 90 to 95% of all diabetes is type 2 diabetes, where your body fails to produce enough insulin or becomes insulin resistant. $245 billion is the estimated total cost of diabetes to this country every year. Diabetes is devastating our community, and in particular, the African American and Hispanic populations. It is estimated that roughly 20% of all African Americans and Latinos aged 20 years or older have diabetes, and most of this is type 2 diabetes. And as you probably know, diabetes is the leading cause of heart disease, kidney disease, blindness, amputations. So to address this growing epidemic, we look to establish collaborative partnerships with groups like the YMCA throughout North Texas. And this is why we're so supportive of this program and applaud its launch. Working together, we can promote both of our respective outreach programs to North Texas and make sure they get the kind of support and the kind of information that they need to battle this disease. So through our partnership, we will provide information about the seriousness of diabetes and its complications. We will teach the importance of eating healthy and exercising regularly. And we will educate those with diabetes or at risk for developing diabetes about prevention, management, and diabetes control. So we are here to encourage you to help us share our enthusiasm about the launch of this program. As the numbers I just reviewed with you earlier tell us, we can no longer wait and hope things get better. We got to take action. It's an urgent problem. It's an epidemic, and we all have to work together to make sure that this epidemic ceases to be such a problem. So join us, please, in helping us work together to stop diabetes. Thank you.
Thank you, Quinn. The North Texas YMCAs are happy to partner with the American Diabetes Association of North Texas to help strengthen the community through healthy living and the YMCA Diabetes Prevention Program. Good morning, my name is Irene Johnson and I'm the Director of Quality Assurance and Program Development of the YMCA of Arlington. I'm here on behalf of Roberto Aguirre, President and CEO of the YMCA of Arlington, who was unable to be here today. Diabetes is a condition that affects all different types of individuals, all segments of society, as well as different ethnic groups. When referring to our Hispanic community in the U.S., diabetes is the fifth leading cause of death, in addition to a leading cause of heart attack, stroke, kidney disease, blindness, and amputations. Less than a year ago, exactly on his 50th birthday, I lost a family friend. After years of dealing with kidney problems, a number of amputations, and losing his 20-year battle with type 2 diabetes. The U.S. is the home of the second largest concentration of Hispanics in the world, with over 50 million Hispanics accounting for 17% of the U.S. population. As a nation, only Mexico has a larger population of Hispanics with 112 million people. As a nation, we are the fastest growing ethnic group in the U.S. Current projections indicate the Hispanic population in the United States is going to grow near to 130 million people within the next 45 years. Within the U.S., Texas is the second state in the nation with the highest concentrations of Hispanics, making up 38% of the state's population. Even closer to home, in Dallas County, Hispanics account for 39% of the population and 27% in Tarrant County. There is no question in anyone's mind that the Hispanic population is, in many ways, an impactful segment of society in North Texas. And because lifetime risk estimates for developing diabetes is higher for both Hispanic men and women than any other ethnic group, diabetes prevention must be a top priority for all of us. To put things in perspective, Hispanics are the largest minority group in the U.S. Texas is the second state of the nation with the largest population of Hispanics, and over 30% of the Dallas, Denton, and Tarrant counties combined population is of Hispanic heritage. Among Hispanics, diabetes prevalent rates are 7.6% for both Cubans and Central Americans and South Americans, 13.8% for Puerto Ricans, and 13.3% for Mexican Americans. The Center for Disease Control estimates that young Hispanic females born in 2000 have a 52% risk of developing diabetes in their lifetime, while Hispanic young males have a 45% risk. Because current conditions indicate that 50% of Hispanic children born today will develop diabetes in their lifetime, when looking at the growth rate for Hispanics in the U.S. within the next 4 decades, we cannot ignore the negative effects diabetes is going to have in society, and specifically the U.S. Hispanic community. Diabetes is a serious threat in the Hispanic community in North Texas.
My name is Alejo Garcia. Thank you to the YMCA for giving me the opportunity to participate on the Diabetes Prevention Program. When I started the program, I wanted to get to my goal as soon as possible. Thanks for the tools that I learned on the classes and the support from the coaches. I learned to make better choices on the food that I eat and to do more exercise, at least 20 minutes per day. It's very important for me because I learned to take control of what I do and what I choose to eat. And whatever I choose is going to help me for the rest of my life to prevent it to have diabetes. Thank you.
Well, my name is Gordon Echtenkamp. I'm the president and CEO of the YMCA Metropolitan Dallas. Alejo, that was wonderful. How much weight did you lose?
20 pounds.
20 pounds. That's great. He was saying he had. And he also told me how grateful his doctor is. He's very happy with the results that you've had. So that's great. Well, on behalf of YMCAs here in Dallas and our YMCA friends in Fort Worth and Arlington, we're really grateful for your participation today and for your attendance. Quinn, with the ADA, thank you so much for joining us today. Would also like to acknowledge a couple of other supporters that are here, a couple members of the board of directors of the YMCA Metropolitan Dallas, and our board has been so supportive. Steve Lovely is the president of the Dallas-Fort Worth Hospital Association, and Ken Malcolmson, formerly with Humana, also here with us today on behalf of our board. Would like to introduce also Heather Hodges, who has come in from the Y the USA, and they really have been the genesis for this entire program. Heather, so thanks so much for being with us today. And thank you to the staff of the Lake West Y, who have hosted us today. So Lolita, trying to make it a little cooler in here, I think. Yeah, sorry about that. Yeah. But especially thank you to Alejo for sharing your story, and to Congressman Veasey. Such important work that we're doing in our community. And, you know, you have heard the message today, and you have heard the drumbeat over the last several years about this tsunami that's affecting adults and kids across our country. Kids that are overweight, adults that are overweight and obese, and we know that this dramatically increases the risk that they will develop prediabetes and diabetes, which has an unbelievable impact on the way they live their lives and on their financial health of their families, but also the financial health of this country, because we know that annual health care costs of an adult with diabetes under treatment, controlled treatment, are nearly $14,000 a year, which are 4 times that of an adult with no risk factors. So it has huge implications for the way we feel, the way we act, our future together, but also our financial future.